Hi everyone, my name is Kerstin Notnagel. I'm a second-year PhD student in the Population Health Science at the University of Bristol. This is an AI-guided handheld ultrasound probe. Pretty cool, isn't it? A clinician in a remote village could perform ultrasound diagnostic with this without a lab, without delay. AI like this is changing healthcare, helping us to diagnose faster, more efficient, and unburden stretched healthcare systems. But there's a challenge. If we don't build AI that works everywhere, we risk deepening the gap to regions lacking infrastructure, like in parts of the global south. To ensure equitable healthcare, we must advocate for policies that support AI technologies tailored for diverse settings. This includes government incentives for creating adaptable tools, infrastructure investments to support the implementation. Innovation is great, but inclusion is everything. Thank you.